Here we go. Hi, this is Paul Slacker's Good News Broadcast, speaking to Doctors Lovera and David Miller. Hi, how are you both?
Hi.
Hi.
You
We're
are both in the world of menopause, and we're going to be talking about a new book called Menopause, Feeling Fit, Feminine, and Fabulous in 4 weeks, okay? And Dr. Lovera is a board-certified OBGNY and a fellow in the American College of Obstetrics and Gynecology. And Dr. David Miller is also NAMS, which is North American Menopause Society, a certified menopause practitioner. So you guys are really into this menopause stuff and focused on it. How come you both focused on this? And are you related? Two
We're
questions.
husband and wife.
Okay.
And we focused on it because I realized from my patients that menopause actually needs a makeover. And men don't get menopause, women do, so we decided to do a play on words and call it Womenopause. And we really wanted to make it over because people don't understand menopause. They equate it with hot flashes, which is an important part, but it's more than that. It's about the acceleration of cardiac disease, osteoporosis, dementia, depression, vaginal dryness, weight gain, and there are simple, safe solutions for these problems. And the good news is that you can feel better at 60 than you did at 40.
You like good news, right?
I was just gonna. It makes me. I get goosebumps when people say we get good news here. Okay, so we have good news here about menopause. All right, and the good news is.
And the good news is that there are a lot of misconceptions about what a person can actually do to control not only their menopause symptoms at the time of menopause, but also keep under control the long-term problems that give them risks for serious health diseases.
For instance, if somebody's overweight, if they decrease their weight by 20 pounds, they will decrease their chance of breast cancer by 20%. That's the 20-20 rule. That's really good news.
Yeah, sure is.
There's lots of good news. For instance, a typical problem in perimenopause and early postmenopause is insomnia. If a person exercises vigorously on a daily basis, that works statistically much better than taking a prescription for Ambien.
Okay.
Exercise also improves sex.
And improves mood.
Okay. And what is menopause?
Good question. Menopause is actually one moment in time. It is the time of your last period. Everything leading up to that, approximately 10 years, is perimenopause. And that's when your periods are starting to change. Early perimenopause, you actually just don't have them as regular. Late menopause, you start skipping periods. And this is because of the fluctuations that are going on in the hormones. And then menopause comes, that's the final period. And you really don't know that because your periods have been so irregular. It's hard to know when your last one is. So it's actually defined by 1 year later, no periods. You look in retrospect, in menopause was a year ago, and there was a celebration that you can't do until a year later because you don't know. But the rest of the life is postmenopause, and postmenopause goes on forever. And it is the really important part to decrease the disease. There's almost no cardiac disease in a woman prior to menopause, but once she loses her estrogen, she loses that protection. If she replaces that estrogen, she can actually decrease her chance of cardiac disease by 40%.
What do you mean loses her estrogen?
Well, at menopause, it's technically the physiological process that is occurring is that the ovary ceases production of estrogen. And so during a normal reproductive lifestyle, her ovaries pours out tons of estrogen and progesterone in this cyclic pattern, kind of monthly. And at menopause, it just completely ceases. And perimenopause, that period of time when it just kind of becomes erratic.
And what actually is
so really
estrogen?
The whole process is really defined by a change in the endocrine status within inside the woman.
And what actually is estrogen?
It used to be that women didn't live in postmenopause. A century ago, they died by age 45, and they didn't know menopause where they had no estrogen. So now a woman actually is living half of her life in this perimenopause and postmenopause time.
And what is actually estrogen? And you said another estrogen is secreted, and what is it? It's a...
Well, estrogen is the primary sex characteristic hormone for women, like testosterone is the primary sex characteristic hormone for men. Estrogen has far-reaching effects. There are estrogen receptors in virtually every tissue and cell in the body, in the brain, in the blood vessels, in the muscles, in the bone, everywhere. And so it has significant metabolic effects on virtually every aspect of a normal woman's physiology.
So if a woman loses... I'm sorry.
That's why menopause can affect so many different things in a woman. It can cause heart disease, osteoporosis, change in mood, mental status, weight gain. You know, all those things that are sort of natural in a way are all kind of driven by changes in the internal hormones.
So it's like a person living without their thyroid hormone anymore. If it quits working, you replace that hormone and get it back to where you're healthy again.
So if I understood what you just said, you said that the estrogen gets depleted or it's over when you have menopause. Is that right? Did I understand that?
Yeah.
Okay, so
Yes,
now,
absolutely.
and you compared it to testosterone. So what happens? Is a woman less sexually, interested as a result?
Sometimes yes and sometimes no. About 40% have really no change in their sex drive. 40% will have a decrease, and 20% will actually get what we call a zest and have improvement.
Yay.
The hardest part for a woman to understand is that she gets vaginal dryness, and it's normal because the estrogen's gone, and that vaginal dryness increases throughout life because the estrogen effects in the vagina are gone, and that's what kept it healthy, vital, with a good blood supply and nice soft folds and moist. That disappears with the estrogen unless you put the estrogen back. And if you put the estrogen back locally in the vaginal area, it will completely treat those symptoms 100% and will go back to that healthy vagina again.
So is that what people do when they have menopause? I mean, you have a whole book here, Menopause, staying, feeling fit and feminine and fabulous in 4 weeks. So is that part of what you all suggest should happen, or what's the premise here?
Well, of course, we lay out in a systematic way all the legitimate treatments that a woman should consider to control the symptoms that she has. And then she can choose to do whatever she feels is right for her. Certainly, we emphasize lifestyle choices because there's really no risk, no expense, and they are tremendously effective. And for some women, they need to have the consideration for hormone replacement therapy that we now don't call hormone replacement, menopausal hormone therapy, MHT. And if that seems right for her, then she needs to know the facts about that. There's a window of opportunity. It should be given as a body-identical 17-beta estradiol, and it should be given through the skin, not as an oral pill. So there's a lot of fine points to all those subjects, of course.
But it's as safe as taking aspirin or Lipitor.
It's safer than Lipitor.
And what other medicine will decrease disease like estrogen? It decreases breast cancer diagnosis in estrogen alone users. If you have a uterus, you must use progesterone also. If you use progesterone, you increase the diagnosis of breast cancer, but you still decrease the breast cancer death. But more importantly, you decrease cardiac disease by 40%, stroke, diabetes, fractures, Alzheimer's, colon cancer, and if you take in all causes of death together, it will decrease all-cause mortality by 40% if you begin it during the window of opportunity, which is within the first 10 years of menopause.
And what is progesterone? That was the other word I was trying to remember. What is progesterone?
Progesterone is the other important female hormone that cycles with estrogen during a woman's reproductive years. It's important for a woman in postmenopause to take progesterone if she still has a uterus.
It protects it from cancer.
It protects the uterus from cancer. But if a woman has had a hysterectomy, then if she decides to take postmenopausal hormone therapy, it really would just be estrogen alone.
And women know this, or I mean, how does a woman notice? They notice because they go to a gynecologist. How do women notice? So we got a lot of women, and do they know these things that you're saying?
Mostly, no, they don't, because studies come out through the media, not through doctors, and it's not medically said so that the people can understand. And that's why we wrote the book, because my patients come in, they don't know the good news, and I'm explaining it again and again and again, and so we decided we really need to write a book and tell everybody.
Okay. What do you mean Susan Somers is not ageless?
Suzanne Somers is, a famous celebrity.
Yes.
She was an actress, and she's kind of known as a feminine health revolutionary, sort of.
Sure.
And actually, we love Suzanne Somers. She's
I do too.
A fascinating, interesting person. But in her book, she has a very famous menopause book called Ageless. That's the title. And so our chapter is kind of making fun of that, because we do not promote hormone therapy as a way to stop aging. That's kind of just ridiculous, in our opinion.
Uh-huh.
Women who made normal amounts of hormones in their 30s, they still aged to their 40s, and they still kept making normal amounts of hormones. So hormones don't stop the aging process. What they do is they stabilize other underlying health problems, and they make some women feel, healthier than they would have without it.
Uh-huh.
And they take away all the symptoms of menopause: mood swings, hot flashes, poor sleeping, memory loss, osteoporosis, vaginal dryness. All things are treated by hormones, and there is no other as effective of medical treatment available. However, you can take an antidepressant if you cannot take estrogen for some reason, and it will decrease the hot flashes by about 60 to 70%. Exercise will too. So that's why we try to cover all the things that you can do, but there's not one better than estrogen.
Okay, and this type of estrogen, is this it's man-made?
Yes, and that's another big confusing part for women. They hear all this marketing stuff about, synthetic hormones versus natural hormones, and mostly that's just a confusing smokescreen. There's really only one place in the universe where 17-beta estradiol is made, and that's within the woman's human ovary. It's not made in plants. It's not made in outer space. It doesn't come from trees. It's only made inside a human woman. And all menopause hormone therapy that's FDA approved that women should consider taking is that exact same molecule, 17-beta estradiol. That's what she normally makes. And it can be made in a pharmaceutical laboratory. Well, the confusing part is that some people market these bioidentical hormones as non-synthetic. That's not true. Pharmaceutical-grade hormones and bioidentical hormones, so-called bioidentical, are all made from plant precursors, and they're chemically modified to be the exact molecular identical one that's inside a woman's body. So we strongly encourage women to consider, if they choose to take menopause hormone therapy, to choose pharmaceutical-grade 17-beta estradiol, apply it through the skin, and that's exactly what their body used to make during their reproductive years.
Okay. Well, obviously, there's a lot of important information, and I will. It's very wonderful that you two are, together in this process. So you're living it as well, and of course, all the men that live with women that the periods and not having a period, it affects a man's life as well. So it's important for a wise man, I say, out there to pay attention to these kinds of things, right? Because they love the woman, and it also affects their life as well. Obviously, you guys are doing a good job here, and you have a website, right?
Yes.
And it is
womenopausebook.com.
And there's what kind of information on here?
Oh, there's all kinds of stuff about the book, and then there's links to our podcast and our blog.
Okay, well, congratulations, and best of luck, Womenopause, feeling fit, feminine, and fabulous in 4 weeks. Why do you say 4 weeks?
Because I do 4-week workshops, and I also do it with my patients. They fill out a W score, which scores all of the symptoms that they may or may not be having. And then it's only a score against themselves. So they come back in 4 weeks after learning the Womenopause Challenge and rescore. And my most recent patient, she went from minus 44 to minus 4 in just 4 weeks. The changes begin to be so apparent within 1 month.
Excellent. Last quick question. What's good news for you guys?
Well, the good news for us is that we live a full, healthy life, and we are 60, and we're healthier than we were at 40. And we have a lot of other things in our life, too. You know, we're very active in Haitian Support Ministries. We've been to Haiti many times, and that's our second principal joy.
Thank you for doing that. That's really important work. There's no doubt about it. So congratulations on your success. And, keep it up. And Lovera, what's good news for you?
My children, I have a 26-year-old and a 29-year-old, and they are my best friends.
I love it. Okay. You guys are doing great. Congratulations. Thank you very much for sharing good news with us.
Thank
Bye-bye.
you.
Bye.
Bye.